Good morning, everyone, and happy Hump Day. I hope everybody's doing well and staying safe out there. This is Karina Hill, and on behalf of the Florida Alcohol and Drug Abuse Association, we want to welcome you to today's webinar entitled Evidence-Based Practice, Importance of Data Collection and Interpreting the Data with Matthew Roosa. This webinar is being made available through a collaboration of the Florida Department of Children and Families Office of Substance Abuse and Mental Health and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode and only will be able to view your name. If you have any questions, please send them to the presenter and myself, the host, by using the chat or Q&A panel. And again, please make sure you select presenter and host so that we can both see the questions. The button to open this panel is usually located on the upper right side of your monitor. Please use the chat and Q&A panel to send any questions you may have as you think of them, and the presenter will address them as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio, there are a few options that you may try on screen right now, and these options are posted in the chat panel. If you continue to experience poor audio to your computer, you can try rejoining the webinar and call in using the telephone I will call in option. You must be connected to the audio of this presentation and also view it on screen to receive a certificate of attendance. And I can't stress that again. You must be able to hear and see the presentation to get credit for attending today. The recording and webinars used in today's presentation will be available on the FADA website within 30 business days. We do try to get it up there sooner if we can. One helpful hint is the archive video displays what looks like to be an error message, but it's only a delay buffer, so you can just ignore it, hit play, and enjoy. To access the recording and PowerPoint, you would just go to our website at www.fada.org and look in the Resource Center and our training library. FADA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credit for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will direct everyone to an evaluation form on the FADA website. You will first need to register or sign in to your account to complete the evaluation. So you must have created a profile on our FADA website to be able to complete the evaluation. Information you provide FADA as part of registering does remain confidential. Statements of credit will be posted within 30 business days after the evaluation closes. So once you complete the evaluation, it is not an immediate posting of your credit. It usually takes up to 30 days. The evaluation closes on Monday, August the 3rd, and it will be posted in your individual professional development journal for persons completing the evaluation and attending the entire webinar. Completing the evaluation is necessary to receive CE credits or to access your statement of credit. Again, please note that the evaluation will close on Monday, August the 3rd at midnight. 1 to 2 continuing education credits are available for participating in today's webinar for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, be sure to include your Florida license number for reporting to CE Broker when you register with our site for the first time. Note, please, that WebEx does monitor your arrival and departure and provides a report upon completion of the event. So we are not permitted to provide contact hours or a certificate of attendance if you do not attend the entire webinar. We are not permitted to give partial credit. And with that being said, I'd like to start off by introducing our presenter, Matthew Roosa. He is a consultant, trainer, and coach providing organizational and system level support for program development, quality improvement, and strategic planning in behavioral and healthcare environments. He is a Director of Planning and Quality Improvement for the Onondaga County Department of Adult and Long-Term Services, providing support to mental health, substance abuse, corrections, aging, and other service systems. As former Clinical Director of Central New York Services, Mr. Roosa provided residential, forensic, and treatment services to people with co-occurring chemical dependency and mental illness. Formerly, he maintained a private psychotherapy practice and taught at Casanova College and the Syracuse University social work program, and is a NIATX trainer and coach. And Matt, if you're ready to get started, I'll go ahead and pull up your slides for you.
Great. Thanks, Karina. Thank you to you for hosting, and thank you to FADA for the opportunity to meet with all of you folks. I'm assuming that my audio is good, and maybe someone could get us rolling with a quick message in the chat box just to make sure that that is the case. Karina mentioned the desire to have you use the chat or the Q&A. She's going to be doing double duty with me in terms of looking at the Q&A and the chat with me. Okay, good. We got a response that we can hear well. That's good. I would encourage you to use the chat, and I think responding to host and presenter, which is one of your options, so that both Karina and I can see that, because she's going to be helping me, because sometimes if I get active in thinking and looking and talking, I might not see every question or comment that might come up, and I want to encourage you to ask those questions and to post those comments, because we want to be as interactive as we can be over the course of the next 2 hours. So please do that and let us know what your thoughts are. I like to be interrupted, as I said to Karina as we were prepping. I don't like to wait until the end or till a break to address issues or questions. If you have a comment or a question related to one of our slides or one of the comments that I'm making, please ask it, and we will try to answer it in real time or respond to it in real time so that we can have more of a dialogue experience. Since you are muted and I'm not able to have an audible dialogue that everyone can hear, we'll try to make it as close to that as we can in terms of some interactivity. So thank you again, and it's great to be with you. So we will go ahead and get started. So let's think about our 3 objectives that you see on the current slide. We're going to talk about data-driven decision making. We're going to talk about that through this DIKW pyramid concept. We're going to think about SMART goals together, and specifically think about a 2x2 matrix in terms of thinking about selecting goals or prioritizing. And also think about implementing selected goals with an overview of the Plan, Do, Study, Act, PDSA, Rapid Cycle Improvement Model as a way to implement changes. Obviously, we've all been involved in a huge volume of changes, and we've all had a whole heck of a lot of data that we've been trying to use to drive and direct some of those efforts that we've been involved in just lately. So I'm hoping that you will view our conversation today as particularly timely in terms of helping you to think about how best to be selective and thoughtful about an efficient practice for using data to drive your decision making and to implement changes within your organization or system. We want to start with a little bit of baseline setting in terms of getting a sense of your familiarity. So Karina is going to pull up a poll for us with 3 questions, and as I think you'll see that coming up now, we want to ask you about your familiarity with these 3 elements. How familiar are you? And as you'll note, all 3 of them have the same 4 choices. A, never heard of it. B, heard of it. C, used it. And D, mastered it. I don't want you to be falsely humble and have no one pick mastered it. By mastered it, I mean, have you used this concept or this tool more than once and used it effectively? Let's call that mastery. Multiple opportunities to implement using SMART or PDSA or data-driven decision making. And if you've done that more than once and you've done so effectively, then feel free to call yourself a master. So let's go ahead and have you look at those. And as you're doing those, we'll wait a minute and see what we get for results. One thing you'll note as we're doing it, and we've got about another minute on the limit on there, so go ahead and get your results in. Data-driven decision making is sometimes more of a generic concept, so you might not sort of perceive that as a specific action that you've taken. But if you have familiarity with the concept and with the general practice, then that's how you should rate your level of familiarity. SMART goals and PDSA are a little bit more concrete for most folks in terms of their familiarity if they've done those and the specific details. And we'll be talking about the nuts and bolts of those as we move forward today. So we'll take just another few seconds to get everybody in on our poll, and then we'll see what we have, and we'll try to steer our conversation as best we can based upon the experiences that you've had as a group. We'll sort of shoot for the largest volume and in terms of the nature of our conversation. So Karina, it looks like we're just about at our 2-minute mark, so maybe we can take a look and see what we have for our results. Okay, so for our first, as you can see, our first question in terms of our familiarity with data-driven decision-making, we have a range of folks, mostly probably a little higher volume in the have heard of it, and not too many folks in the mastery category. For our second question related to SMART goals, we have a little sort of an interesting range. People have used it, so as one might expect, almost twice as many people have used it as have never heard of it or have just heard of it. So a good number of folks have used it. Appreciate the good number of respondents here, 180 of you, which is great. So slightly more familiarity with SMART goals in terms of having used it. In terms of PDSA, we have a high volume of folks not having heard of it previously. Small number of folks who have heard of it or used it. Only one person in the mastery category, so we have a PDSA master out there, someone who's highly familiar, but by and large, not something that our audience today is familiar with. So 78 of you out of 180 said have not heard of it. So that's going to kind of drive our conversation a little bit in terms of PDSA. So that'll be a good introduction. I don't think that's the bad news. I think that's the good news, because I always like to get that knowledge out to folks who are not familiar. So PDSA is going to be something we'll spend a good chunk of our time on today. So thanks for that poll, Karina. I appreciate it. It's helpful to get us kind of dialed in terms of how to think about this together as we move forward. All right.
So while we're moving on, if I could just remind everyone to please respond to host and presenter, that would be great. Thank you.
Yes, thanks, Karina. Yeah, that'll be important as we're looking at our chat box. I'm going to keep this chat box open, and it's easier for me to just keep the one chat box open. So if you do put it into one or the other, please put it in the chat box. That'll be helpful. Keep an eye on that. So we want to talk about data first. Couple of somewhat cliched ideas. If you want to change something, measure it. We attend to the things that we measure. I think all of you know that. If you think about your experience within your organization, within the programs, and within your life in general, if you want to work on something, improve something, you need to put some kind of a measure to it. Because then we're all left asking that question, how do I know if it's better or not if I don't have a way of measuring it? Well, did you make an improvement? Is it better than it was before? Yes, it's better than it was before. How do you know? Well, it just kind of feels like it is. If any of you have tried to bring that to your executive director or to your board of directors or to your funder, either government or third-party payer, or to an agent that is the representative from an oversight entity of whatever kind, and you say, well, I just kind of think it's better. I'm guessing you don't get the result that you want, and they say, well, you're going to have to prove that. You're going to have to show me. And we all know this. We all believe this. Very few of you would probably argue with this point. But turning that belief, that understanding, that wisdom into reality, into practice, is a whole other thing. Many of us are neglectful in our systems when it comes to measures. Often that's because we try to do things that are too complicated. Often it's because we don't engage our teams effectively. We don't necessarily prioritize that effort. We don't necessarily have the right folks on the team or engaged with the team or on our staff to effectively think about measurements. And sometimes it's because we overestimate the challenge of measures, because we tend to think of it as the kind of that's the purview of accountants and data geeks, and that's not who I am, because I do other stuff. I work with people, I do human services, and so that's not my thing. So part of what I want to do today is to try to make sure that you know that it is your thing, and that the work that we're going to be talking about today is stuff that all of you can do and should do in order to be effective. There we go. Okay. So thinking about the data, um, the data is the wind, the data is the compass. I want to encourage you to think about the critical and central nature of data. When you think about your programs and your services, probably the first thing that you say, if I were to ask you, and feel free to put something in the chat box on this, if I said, well, what's the most important thing that we need to know about your services? What usually comes to mind? What's the first thing that you would say to somebody? Let's set aside, it might be something related to data, but often it isn't. Go ahead and pop something in the chat box if you like. What's the first thing that comes to mind in terms of the critical importance of your service? Well, if someone says, what do you do? Well, why should I care about that? Well, how do you answer that question? Why should I care about what you do? Somebody might have an answer they want to pop in the chat box. Usually it's some version related to your mission, your mission and your values. And the only way you convey that to folks effectively is by sharing some data with them. We have the data to prove that it's effective. Absolutely. Thank you for sharing that, Liam. Provide services, skills, making people healthy, make healthy decisions, right? We provide youth with the life skills to make healthy decisions, came in from Amanda. Right. And so then the follow-up question to that is, how do we know that that's the case, right? We help people to sustain recovery and become independent. Again, we have people, attendance was brought up. There's a nice data-driven element. Provide prevention programs in schools. Provide services that help people function better, et cetera. Okay, these are all great examples, and they all beg that next question. How do we know that that's the case? And all of you have measures to some degree that allow you to make sure that you can convey the reality of that assertion that you're making. I love all of these assertions, and they all require some data in order for you to prove that it's true, because a cynical listener will respond to you, how do I know that that's true? How do I know that there is a return on investment? So when we talk about data, I want to talk with you about this DIKW pyramid. This is a model that some of you may have seen before. It's used in a range of environments. It's used in a lot of thinking about data and information across multiple industries and academic environments, right? I think it's a really kind of useful tool to think about this stuff. So take a look at this with me. So at the bottom of the pyramid, we have data. Data is something like this, 137. There's some data, and it means nothing to you. And it means nothing to me because I just grabbed it out of the air, but it's a number, right? That's data. It's a discrete element. It means nothing without context, right? That's obvious. Then we think about information, which is linking these elements together, right? Linking bits of data together to kind of create some context. And then we think about knowledge, which we gain by organizing that information, and then applying that knowledge, we get to wisdom. We aspire with all of our data to get up to the top of the pyramid toward the knowledge and wisdom category. So let's take a minute to think about that together, right? So we have this increasing connectedness and understanding as we go up that pyramid, as we start to understand the relationships between the data elements, and then as we move up into knowledge to understand the patterns, so from relationships and context into patterns, and then principles. We get to wisdom, we get to principles where we apply what we're thinking about as we look at the information and the knowledge. So what does that mean, and what do we do with that stuff? So here's a simple example. So if you just look over that slide to the right of the slide and look at those examples. So people were served, right? That number of people, 257, were served. That's our data. In and of itself, doesn't really drive any decisions, right? We got to then think about what that means in terms of information. We get a little bit more information about the service. We link the elements of some data in terms of when people arrived, ages of the people. So now we've got some more data, and we start to link those things together, which gives us some knowledge. So when we get to the knowledge category, we're starting to notice something about our population, right? How we need, who we're serving when, how people are arriving. And then we get to wisdom in terms of how we think about decision making and what we need to do as a service. Now, this is not rocket science. All of you do this stuff all of the time when you think about data. Very few of you would say we're data driven, and we're data driven by 257. You wouldn't say that to anybody, because it wouldn't make any sense and it wouldn't mean anything. You all do this pyramid. I think the idea is to use this concept to teach your teams to think collectively, to aspire to the highest level, because sometimes data becomes what folks think of as a sort of a mandatory requirement. I have to submit data to my boss has to submit data to the executive has to submit it to the board has to submit it to, or executives and administrative teams have to submit it to regulatory entities or to payers, et cetera, rather than thinking of it as what's driving our quality, that it's not just a sort of perfunctory requirement. Let's think about it as a way to get to wisdom. Most of us, when we think about wisdom, tend to not think of it as a data-driven experience, but it very much is if you think about it within this context. So I would encourage you to use this pyramid, these simple ideas on this pyramid with your teams to think about a structure for yourselves. I don't know if anyone's ever used it before or seen it before, but I would strongly recommend it. So thinking about what DIKW you have to track your own evidence-based practice implementation or change implementation, with each of your changes that you're implementing, think about this pyramid and think about how you clearly and concretely and intentionally look at these 4 levels. What's your data? What information does that give you? What knowledge do you gain from that information? And how does that create wisdom that drives your practice? Applied knowledge, applying that knowledge that you gain from the numbers in order to change your practice. So if you ask that sequence of questions, that will help you dramatically as you're working with your team. And it's also a good way to engage your team. A lot of times we have team members who are not particularly data oriented. What we often do is we see leaders trying to shift toward a mission-driven conversation with those team members in order to keep them oriented and motivated, which I think is really important and valuable. If you use this pyramid, you can link the 2 things together, right? You can look at the data and then link it to that orientation that you have, that you've gotten through your mission or your vision statements, and look at how the data and information becomes the foundation for how you live that mission statement, how you move forward toward that vision that you have as a service provider. So this, I think, can be a helpful tool for you to use in that manner. Okay, I want to talk with you a little bit about the implementation challenge. And as I'm talking about this, we're going to use a little bit of a metaphor here with the beach and the sand. Feel free to give us some comments in terms of your own experiences about this. So one of the frustrations that I often have when I work with folks who are doing implementations is that they will do a lot of work on implementing a change, and they will be pretty effective in the front end, but they are not able to sustain it. And then if I go back and talk to them a year later, they say to me, I asked them, how's it going? Because it really went well when you first started this. You had great results. I said, yes, we did. How's it going now? I said, well, we stopped doing it. And they're usually frustrated and a little sheepish about sharing that. And it's usually because of there's a range of different things that get in the way of implementation. Sustainability is one of the hardest things for any change, right? It's easier to do a change, although it's never easy to do a change, but it's easier to do a change than it is to sustain that change. So that's one of the most frustrating things about implementation, right? All this good hard work, this great investment of energy, and we don't experience the return because we're not able to sustain it. So if we think about this visually, right? So if we think about your evidence-based practice or whatever it is that you're doing, like water that's flowing out of this spigot here. The big frustration is that a lot of times these evidence-based practices are just like water going out into sand. They just sort of dissipate on us. We need a container to hold them. So you see those simple graphic representations in terms of some quality improvement or practice or process improvement to be able to hold on to that best practice or that evidence-based practice that you're implementing. And we need some team supports around that as well as another container. That process improvement or practice improvement or quality improvement work really is where the data-driven decision-making comes into play. So at the core of any effective ability to sustain an implementation, we have to be data-driven in order to do that. Many of you, if we ask, could tell us tales about how you've implemented really effective and impressive changes, but have not sustained them. And in large part, it's because there was not a data-driven quality improvement practice, a data-driven decision-making process that helped you to keep your eye on it and to maintain it and to implement and sustain effectively. So the stakes are high here in terms of thinking about data and making sure that you implement effectively. So I want to talk with you about what is data-driven decision-making. And I want to start with a cautionary tale. And as I start this cautionary tale, I want to first acknowledge this is a tale, as noted, it's a picture from Utah, 1869. So this was the Transcontinental Railroad and the Golden Spike. And this is a promontory summit near Ogden, Utah, in the spring of 1869. Right. So first thing I'd like to say about this picture, as is the case with many historical images that you're probably familiar with, this one is not an accurate depiction of the history of the workforce that was engaged in that Transcontinental Railroad development. In fact, on the day that these pictures were taken, there were hundreds, if not thousands, of Chinese workers who had been involved in the development of this railroad. They were all denied access to, in large part, to the photographs that were taken. They were sort of pushed aside and not allowed to be in the photographs. So we see a sort of literal and figurative whitewashing of the history here in terms of who was actually at this event and who had been the workforce who was largely responsible for this tremendous feat of engineering and development. So I always like to start with that acknowledgement of the workers who weren't depicted here. So let's think, all of us know the story of the railroad, like coming from the west and coming from the east, and for all of the cultural implications of what that railroad meant, it was in fact a major development in terms of being able to unite the entirety of the country with this railroad. So we had the Union Pacific and the Central Pacific Railroad teams both pushing from side to side. So when we think about this as a cautionary tale about data, why am I saying that? Well, the railroad building teams were paid by the mile. And as I said at the beginning, at the top of the hour, you focus on what you measure. You get what you measure. You put your energies into what you measure. And in this case, they were being paid by volume of miles of track that they were laying. They had yet to establish a rendezvous point, which is what we see here. So these teams are just being paid by the mile. So a very bizarre thing happens. You see the top red line across there, which is what you would have expected they would have done, that they would have been paid for the accuracy and the focus toward that point of connection. But that's not what they were paid for. They were paid for miles of track. And so what they did, sometimes hard to believe, is that the two teams kept running mile after mile, overlapping each other. Oftentimes, it's been told, blasting away, throwing rock and dirt on the backs of the other team, working in the opposite direction as they passed them for miles. So miles and miles of track being laid in two different directions, which would have absolutely no benefit, obviously, because it's impossible for them to connect. But that's not how they were being paid, so they didn't care. So they pursued an action which had absolutely nothing to do with the eventual goal here, which was to unite these two tracks, for miles and miles, because that was the nature of the measure, and that was the nature of the payment system that they'd established. So as I said, obviously at some point they figured it out. There was no logic to it in terms of our thinking today, because we had the measure of, our measure is to, put those two things together and connect them. So a simple, kind of bizarre historical narrative to think about how you have to focus on what it is that you seek to measure, and make sure that you're measuring the right stuff in order to achieve the goal that you want to achieve. So data-driven decision making, we've got 8 core components. And we're going to talk our way through these 8 components. Just so you know, we're going to take about a 5-minute break at the middle of our presentation time. So at around 11 o'clock, not maybe exactly, but somewhere in the neighborhood, we'll find a decent spot for us to take a break. And then we'll take 5 minutes at that point, and then we'll wrap at around noon. So let's think about these 8 elements. We're going to work our way through all 8 of them. So I'll just let you take a look at them for a minute. Defining measures, collecting baseline, defining a clear aim, consistently collecting data, limiting your data, reporting and charting, considering a secondary qualitative measure, and asking questions. So we're going to take a minute or two with each of them. Take a little time to talk about each of these so you can think about these core elements. Now, is this the definitive list of data-driven decision making? No. It's not. Someone else will give you a different list. I think it's a pretty good list, and I think it covers the territory that's critical for you as you think about how you use data in your own work. So defining measures clearly. Let's think about that. Just like we used with our example a minute ago, that was clearly an example of pretty poorly defined measures. I want to encourage all of you to keep it very simple, because data gets complex in a big hurry, okay? So thinking about defining your measures very simply on the front end, because it does start to get complicated. I encourage people to count stuff. Think about your data as counting stuff. That's sort of a simple way of thinking about what we're trying to do. And we've all seen it. You've all experienced it, I'm guessing. That when you've implemented something, you've had somebody who's been in charge of the data, or someone who's been reporting the data, and then you get data and it's confusing. And then you ask them about it, and they say, oh, I thought we were counting it like that. Oh, you mean the people who cancel their appointments don't get counted as no-shows? Well, I mean, like, is it the same if they cancel on the same day or call at the time of the appointment as opposed to if they call the day before? How are we defining a canceled appointment or a no-showed appointment versus showing for an appointment? So these things will get complicated in a hurry, no matter how simple your data structure. And then you add in issues of staff changes or turnovers, the need for cross-training if you have different people who might need to be a part of gathering your information, your data. And you can see how it gets somewhat complicated very quickly. So I'm encouraging you always to think of the simplest measures that are useful to you. And if you have a choice between a measure that's simple and good enough, or one that's more complicated, that's really the perfect measure, go with the good enough measure. Always go with the good enough measure, as long as it is a general reflection of what it is you're trying to measure, because that more complicated measure is most likely going to fall down on you as you start to deal with all the human factors. And feel free to give us a question if you're sort of thinking differently about this or have a contrary opinion. We want to hear those. I think it's helpful. We did have a question about the PowerPoint. Yes, you will get access to the PowerPoint, and Karina, I think, mentioned that at the top of the hour, and she can certainly provide you with the information and access so that you will get the slide. Okay. So collecting baseline data. We have to know where we are in order to know where we're going, right? We have to have a comparison point between where we start in order to understand if a change is in fact an improvement. We have a baseline, and then we do something, and we'll talk about this related to the Plan, Do, Study, Act, PDSA change cycle. This is an important part of that process. It's surprising how often people get started with a change without gathering baseline data. So you need a comparison point when you implement a change, just like basic scientific method. You got to take a measure before you introduce whatever your variable is and see if it has an impact. many of us get in a hurry and we implement a change and then we measure and then we realize, oh, we didn't measure before we implemented the change. So you have to slow down on the front end, to take a minute to think about what that baseline is before you introduce the change. This is something that surprisingly happens a lot because we're all in a hurry to try to get that change rolling. But take a minute, don't rush, consider what your baseline is. I would be curious to see if anyone wants to share an experience of any baseline that they may have forgotten to measure. I think it's always helpful to think about that with folks. So I'll keep an eye open on the chat box to see if anybody comes up with anything that they'd like to share. You have to be humble and willing to acknowledge the error to do that. And I always appreciate people who are willing to do that. Okay, let's think about number 3 here, defining clear aims and goals, right? We're going to take a little detour to SMART goals here to talk about what SMART goals are, because that's the best way to, I think, to talk about defining a clear aim or goal. Nice aim statement, as you see it kind of highlighted in red there, is and some variation of this is a good model for coming up with an aim statement. We want to improve A from B to C by date D. We want to improve attendance for our first appointments from 50% to 70% by November the 1st, or by the end of the year. So some concrete goal with clarity and a comparison point between where it is now and where you'd like it to be. So we see we're building our baseline right into our aim statement here. And then we want to put a date on this, because it's not going to maintain, we're not going to maintain our attention on this aim if we don't put some urgency to it and say we want to have a deadline on this. The clock should be ticking on us. We want to be realistic and reasonable, but we want to give ourselves a bit of a push. So some of these elements that we've been talking about are embedded within the SMART goals. And as we were looking at our SMART goal poll at the very beginning, we found that a good number of you had some familiarity with SMART goals. So we'll take a little bit of time to kind of work our way through those elements. Not surprising, because the concept of SMART goals is very prominent out there in the measurement world and the quality improvement world. And so the acronym as laid out here, we'll take a minute to think about those elements and what they might mean when we're thinking about your own implementation, your own quality improvement work within your programs. So specific, narrow goals rather than vague or diffuse, right? So a very specific goal. I think the aim statement that we just had up on the board is a good example of being specific. Sometimes there are specific steps or elements that you need to articulate. I always encourage, if something is a complex, broader goal, well, let's call that a kind of broader vision. Let's break that out into the subparts as best we can. And those might be sequential, all toward a broader vision or a broader orientation of how we would like to see our service delivered. Something like highest quality customer service, is not a specific goal. It's a broad general category of vision, and we need to get to something far more specific. Think about the subcategories that represent quality service to you as a team and as an organization, and most importantly to your consumers. So a little plug here to include your consumers in any of these processes as best you can. I would strongly advise you to try to have consumer input when you're thinking about any of this data-driven work, because your consumers are a critical resource. They can see and understand things that your team might not be able to see and understand. Okay, just want to check last comment we had. Have clients internalize the information and start using the skills that were taught? Yeah, I like that comment. It's kind of relevant to what I was just saying, I think. Using the skills that were, and thinking about this actually in terms of working with clients, some of these concepts in terms of being data driven and using SMART goals are very effective in direct care. So they kind of cross over, not just in terms of quality improvement and managerial orientation, but also in terms of direct service. So I like that approach. So if we think about measurable goals, where are we at with measurable goals? It might be a bit of a challenge to think about this. So think about our goals easily measured. We talked on the front end about keeping things simple, keeping things clear. If we have a goal like we were just speaking about that's more vague and less specific, we won't be able to know whether or not we achieve that. So our goals need to be measurable. What is the yardstick that we can put on this to know if we achieved it or not? And that'll be, again, part of that PDSA orientation as a way to think about implementing changes. Do we have data collection that allows us to address this issue? Do we have a system in place? Do we have resources? A mistake that a lot of folks make on the front end of this kind of work is that they have lofty expectations and they get rather complex with the measurement and with their goal structures, and have to be realistic and think about the amount of resources that are required in order to effectively measure and implement those measurements and to accurately collect the data related to them. So again, keeping it simple and clear. Okay, attainable. So let's talk about attainable here. Anyone wants to share a comment, that'd be great right now in terms of your perspective about how you might set goals that are attainable. What do you do? I have a little theory about a little idea I want to talk with you about how to establish a goal that's at the right level. And we're going to talk about that 2x2 matrix for a minute. But any comments from anybody right now would be great before I kind of share that. How do you come up with a goal that's realistic? That's not too high, that's not too low, that's kind of realistic and helps you to move forward. You know, we want to improve. I was using the example of people showing up for the first appointment. We want to improve it from 50% to 100% by next week. Probably not too realistic. On the other hand, someone might say, we want to improve it from 50% to 55% over the course of the next 6 months. You know, not exactly much of a stretch. Okay, so people are responding a little bit here. Improve upon a strength that is already working for your baseline. I like that, right? So we have momentum already. How can we take that momentum and move it forward? Enhance existing services first. Goals and measures are realistic. Ensure that all resources are in place for obtainable prior to setting that goal. Yeah. Completing the program, knowing your client's abilities, right? Kind of thinking realistically. Looking at the data over the years to look for realistic percentages of improvement, right? Kind of what do we have in terms of benchmarking or baseline? Looking within our organization, looking outside of our organization, looking for benchmarks. Knowing your clientele is another comment. So yeah, I like all of these examples. They're great. So this is the kind of thoughtfulness that should be going into establishing goals, right? That are attainable. Should be higher in order to have a positive to reach for. There's nothing wrong with a wish list. Yeah, okay, so let's talk about that. Great segue into this next idea, the wish list idea. So we should push ourselves. So I like stretch goals, what I call stretch goals. So what do I mean by stretch goals? I like the concept of a goal. If you have a team of folks, let's say you have 6 or 8 staff on your team, and you're trying to figure out what your goal should be. I like to encourage folks to have a goal that about half of the team thinks that you can get to, that is doable, and about another half of the team says, nope, that's too high. We're not going to be able to achieve that. That's a nice stretch goal because it creates a little bit of tension, a sense of urgency, a little bit of a push. So you're reaching beyond your comfort level as a team a little bit, but not so far beyond your comfort level that it becomes perceived as undoable or unmanageable, because that can be demoralizing. You know, if a supervisor says to a team, hey, everybody, we're going to get our show rate from 50% to 100% in 3 weeks. Let's go. The team will probably look at you like you've got 3 heads and say, you don't know what you're talking about, and you really don't have us. We're not with you. We don't feel that sense of urgency. That seems kind of ridiculous to us. So that is way too much of a stretch. You've stretched it to the point of breaking. On the other hand, if you don't stretch at all, then there's not much momentum, and you have to ask the question, why are we even bothering to work on something if we're not going to try to make it significantly improved? So finding that balance point where about half the team thinks you can do it and the other half thinks it's not realistic, that's a nice tension point with the team. So I would encourage you to try that experiment with your team the next time you set a goal. Try to find that spot where about half of them keep their thumbs up and say yes, and about half of them say, I don't think that's going to happen. Then you're probably at the right spot. Just an experiment. I would encourage you to try it and then set it at that point and see how it goes. Okay? So now we want to think a little bit about this attainability in terms of goals and talk with you a little bit. I like to use the 2x2 matrix as a tool in a lot of different ways to think about an analysis, a simple analysis of any two variables. In this case, we're talking about attainable goals. And so on the bottom axis, we have, is it doable, right? So the bottom left, it's not very doable. Bottom right, it's highly doable. And on the up-down axis, on that y-axis, we have impact. On the top levels, it's high impact, and on the bottom levels, it's low impact. So on the bottom left box, we see this the low of both, right? It's low impact and it's low doable. So why would you want to do something that's really hard to do that has almost no impact? We're never going to want to choose that one, right? That's a no-brainer. We don't do that one. We go diagonally up to the top right, we see something that has high impact that's high doable. It's very doable. So it's easy to do and it has a big impact. This is what we call the low-hanging fruit, right? There's an apple that's 4 feet off the ground and it's perfectly ripe and it's ready to go. You pick it. Again, that's a no-brainer. You do that stuff. That's the stuff that you do, right? Because it's going to have a big return on it. Modest investment, big return. If we look at these other two boxes, that's where we get to some interesting questions. If we go to the upper left box, it has high impact, but it's low doable. So it's a challenge, but it has a big impact. So if you're playing the game of Monopoly, this would be like Park Place and Boardwalk, right? You get Park Place and Boardwalk and put some houses and hotels, for those of you who know Monopoly, which is a lot of people. It's going to be expensive. It's a big investment, but you get a big return when somebody lands on it, right? So you have to make the decision. It's going to be costly, but should we do it because we get a big impact here? And conversely, on the bottom right, we have low impact and it's very doable. That's sort of like those less expensive properties in Monopoly, right? You don't get a whole lot of money when people land on them, but they're not very expensive. So are there changes and things that we can do that are simple and easy? They don't cost us much. They're not that difficult for our staff. They don't create any big challenges for our clientele. And they have a modest impact, but they seem to be beneficial in some modest way. So maybe we could do some of those. So this is helpful in thinking about attainable goals, right? So we definitely don't want to do the low items on the bottom left. We definitely do want to do those low-hanging fruit items on the upper right. And then we ask ourselves the question on the upper left and lower right, what about those? Those are sort of question marks for us to think about. So I'm just checking our comments here. Continuum to work for, starting with the high impact and high doable, and then work towards high impact, low doable as you build capacity. Yeah, I think that's a nice way to think about it. You start with that circled box. That's your best place to start, right? And then you think about those upper left and lower right boxes and think about the items in those as sort of next categories for you. And you always stay away from that lower left box because that's really not going to be a good investment, because there's plenty of stuff that you can do in those other three, starting with the high box, that will be very useful for you. And then understanding common, I'm just sort of reading our comments as well. Investing in the future is money in the bank, wellness with the harder goals. Yeah, that's a good idea, right? So it's harder and more challenging, but you're investing in the future. So that's a good place to think about those more challenging investments, that upper left box. I encourage people generally when they're first getting oriented toward process improvement and quality improvement work to try to stick with the high impact and highly doable items in the upper right box. as best you can, because it's a nice place to start, particularly if you have teams that haven't done a lot of quality improvement or process improvement, because you see strong return on your efforts, and it builds good momentum with your team. So I always encourage people to try to start there and then to move into the other territories after you've had some good successes, because nothing, as you all know, nothing builds good momentum on a new practice more than having a successful experience. And we'll talk a little bit about that later, I think, as we talk about the PDSA stuff. So again, I really encourage that 2x2 matrix. I think it's a really nice tool, not just for this. If you're considering two variables, those 4 boxes, thinking about where things sit in those 4 boxes can be a really useful tool for a lot of different analyses of issues when you have two variables that you're trying to consider. And it's a nice way to do it with your team too. Put it up on a board in front of your team when you're trying to do some planning, when you're trying to do some analysis, to just put up those 4 boxes and kind of think about stuff in those categories is a good way to help people to get clarity on a couple of variables. So, all right. So as we keep moving on, we think about the R of the SMART, and we get to relevant. Is it relevant? Is the goal relevant? Does it address a significant unmet need for your organization, for your community? So relevance is key here. Sometimes the data that's easy to gather is related to elements that are not so critical or relevant to your mission. Sometimes the data that you need to really find out how you're doing related to a part of your mission might be hard to find out about. You know, we're all about recovery. Well, I'll ask that as a question if anybody wants to pop it in the chat box. How do you measure recovery? If you're promoting recovery in your community effectively, how do we know? Go ahead, pop in a measure if you think of it. You know, what is your SMART goal as it relates to your work to promote recovery in your community? I say that specifically in your community as opposed to with an individual, because you might have individual goals. But let's think about this from more of a macro goal. Promoting community recovery, and how do you measure that? How do you have a sort of a relevant data point for measuring that? So we'll keep an eye out for those if any of those show up for us. Harm reduction, sustained recovery for sure. Yep. We can specifically measure some of the harm reductions, and we can aggregate those, and some of the reductions in arrests for drug possession, right? We can kind of monitor arrests as an indicator, right? If we are effective in reducing, in promoting recovery, we should see a reduction. So those are some good indicators that people are thinking about. Now, is any one of those perfect? Absolutely not. They're available to you. They're relevant. They're available on a timely basis. Are they things that you can measure? They can be measured periodically. Return to treatment, reductions in return to treatment, so relapse and return to treatment, increase awareness. These are all things people are typing for us. Increase awareness of recovery services, or increased amount of services available, right? So all different forms of measures that you all are thinking about that measure different facets of this thing that we're calling improved community recovery. So, and the last of our goals is the T for, the last of our SMART goal elements is the T for time bound, right? I mentioned earlier the need to have something of a stopwatch on the process. If you don't put a stopwatch on it, it's kind of like a race without a clock. You know, well, just run as fast as you can, and you know, we'll give awards to people based on how good they look as they run around that track. Wait a minute, we need to have a time limit to understand the level of performance here within a given time, and we have to put a sense of urgency onto our team in order to make the improvement. We can't say to a team, we want you to improve this whenever you get to it, that's fine. That's not exactly a good charge or a good motivational speech for a team, right? We have to have a clear agenda in terms of our sense of the time limits in order to cultivate some urgency and to create prioritization. It's highly unlikely that you will have prioritization of a task unless you give it some urgency with regard to a time limit. This is a mistake a lot of organizations make when they set goals, is that they tend to set multiple goals and with multiple measures, and they set them with a without a time limit to them. Let's continue to work on this, and we'll continue to work on those other things. And so we don't have prioritization and a sense of urgency, and so we don't have the dedication of resources appropriately to really drive forward. So I always will encourage folks to limit the number of goals and limit the time, and to the best of your ability, try to create that urgency. And when we talk about that sense of stretch goals, incorporate the stretch goal idea into this time limitation, right? So when we were talking earlier about developing that aim statement, the amount of time should also be a stretch. Well, how long will it take us to do this? Well, I think we can do it in 6 months. Well, I think we can do it in 3 months. Well, let's as a team, let's kind of come up and find that tension point as to what's realistic for us in terms of our SMART goals. All right, so a question I would ask any of you when you think about this, and this will probably lead us toward our break here. What do you think is the most challenging of these SMART goal elements for you? And if you have any comments about them as we've covered them, go ahead and type those in the chat box, and we'll take a couple of minutes to kind of get some feedback. Which one or ones of these is the most challenging to you? And if you have a comment as to why it's a challenge, then let us know. So any thoughts about that? So I forgot, we actually have a poll about this one. Thanks, Karina. So these elements do you find most challenging? So go ahead and give us your poll response and let us know which one is most challenging to you. I actually think we have this open so that you can select more than one. So if you have 2 or 3 that you find most challenging, do me a favor and don't select all 5, because that's kind of like a non-vote. So try to prioritize which ones of them are most challenging to you. And people have different reasons, and we'll kind of, actually, as you do that, we won't know the why. So after you plug in your elements, then if you want to put a little note in the chat box as to why you picked one, that can be, I think, helpful feedback for us to share with each other. So it's always good to hear the reasons behind that perspective. So we got another 30 seconds or so go ahead and take a minute to think about those. And after we look at these, probably take our break. All right, so as I'm seeing people sharing a good number of chats here, which is helpful. I also saw an urgent chat with regard to hurricane prep here. I know you all who are in Florida are looking toward a challenging weekend. I want to wish that you all be safe and well. All right, so we have our time up on our poll, so we'll check our results and see what it looks like here. Thank you all for doing that. Let's see what we have. All right, so an interesting spread. Let's take a look here. So if we look at SMART across them, there's a relative spread. Not too many people were concerned about the relevant. A few were. Highest numbers on time-bound, thinking about time-bound, and thinking about measurable. Okay, measurable, I think, is the one that I kind of usually expect that people will have the highest numbers on. So it did by 1 have the highest number, but time-bound is also quite a heavy response, and I think it's interesting to think about that one. And if people want to share in terms of chat as it relates to that one, why it is that time-bound or measurable might be a critical concern of yours, that would be good. I'm just going to take a look at that. So lack of follow-through in terms of attainability. I'm just going to kind of look through these and see what we have. Information we want to measure does not have data points. in our EMR. So yeah, your EMR is critical, right? So how is your EMR set up? We haven't talked about that. We're not talking about the nuts and bolts of technology as it relates to collecting data, but all of what we're talking about today has huge relevance as it relates to your EMR or your data collection tools and systems. So clearly, you need to involve any folks who are the folks who are managing that system when you're looking at any kind of measures like this. Um, uh, so there's some agreement with what we were talking about before in terms of the measurability, how precisely to define things, and measuring recovery, et cetera. Those are kind of nebulous things to figure out in terms of measurement. So we have to have some indicators, right? So what's an indicator of recovery? Some of you came up with examples. Are they recovery itself? No. Idea that's been used by a lot of folks is, you may have heard this concept, the map is not the territory, right? The territory is recovery. And when we want to make a map for measuring that, we can't sort of put that on a map. We have to have some indicators which help us to think about how we would measure that. It's important to maintain that distinction. We can't measure recovery, but we can measure things that are indicators of recovery. So that distinction helps us to think about this. And that's how you get into it when people, that's how you get clarity when people say, but that's not what recovery is. Well, no, it's not what recovery is, but it's one indicator because we don't have a way of sort of taking the pulse of recovery. It's not like taking someone's temperature or blood pressure. But we have some things, we can't take the community's recovery temperature. But we can measure certain things which, when we put them together, give us a sense of how the community is doing as it relates to recovery across time. And that's what we're looking for there. And that is not an easy thing to do. Some people said attainable because of the lack of follow through. It's hard to find data points in the EMR, as I said before. It's an important one. Pick measurable for the reasons presented before. Specific. We work with so many different programs. It's hard to narrow it down to something specific. Okay. So we see a range of challenges. So sometimes the SMART goal idea becomes sort of a not very focused upon when people are thinking about measures because this idea of SMART goals runs the risk of becoming a little bit too commonly known. And so we tend to just say, yeah, I know what SMART goals are. That's what I do. That's how I think. I would prefer that you try to think about it like a checklist. I'm a big fan of checklists. I think they're very useful. They're used in a lot of other industries. We should use them more in our industry. And when you're thinking about creating goals, the SMART, S-M-A-R-T checklist for your goal consideration is a nice, simple 5-point checklist. Okay, here's where we're at with our goal. Let's make sure it checks all 5 of these boxes. I think that is an excellent spot for us to take a break. We're going to then get back into the issues of the data-driven decision-making that we took a little detour, and then we'll get into PDSA stuff after that. So, Karina, do we have any guidance other than we're going to go for 5 minutes?
No, if everyone could be back about like 8 or 9 after, that would be great. Thank you so much.
All right, excellent. Thank you all, and we will see you in 5, and we'll continue on after that. So thank you for your participation and attendance. We will be with you in a little bit. Okay. See, that was a quick 5 minutes, and hopefully you've had a chance to get a little quick stretch. Karina, how are we doing? Shall we get rolling again?
Yeah, I think we're pretty good, and you're doing a great job with answering questions and reading all the comments, by the way.
Oh, thank you. Thank you. Well, I decided we'd just stick with our chat box, and I've got a nicely open here, so it's been going well. So that's good. All right, so I think we're good to keep going. Welcome back from our quick break. We'll proceed. We'll be working together for the next hour. We'll wrap up just before noon, and Karina will have some final nuts and bolts of business for us at the end of our conversation here. So we talked a little bit there before our break and wrap in terms of some of the specifics around SMART. So again, I reinforced that notion of using it as a checklist and hope that you're able to try that. Just another note on checklists. I often like to use examples from other industries, and if you go, although none of you are flying much these days, but if you think about any times you've gone onto an airplane and looked into the cockpit if the door has been open, and have seen the pilot with that book, like usually a sort of a notebook kind of a thing, or a spiral bound book, where they're kind of looking through the pages of the book because they have a lot of procedures and protocols that they have to complete prior to takeoff, and they use checklists to do that. I don't know if any of you have ever said to yourself, gosh, I'm a little worried that he or she doesn't know how to fly this plane. It looks like they need a manual. Mostly we don't say that. We understand that what they're doing is ensuring accuracy of their process by using the checklist. There was a great book written a few years ago by a surgeon named Atul Gawande. You may have heard of him. He's written a number of books, a very successful surgeon and author around quality and healthcare issues. And he wrote a book called Checklist Manifesto, which was promoting this idea, excuse me, of checklists. And in that book, he uses that example among others. So I use that example as a way of encouraging us to think about checklists, because sometimes when we become relatively highly skilled in an area where we've mastered it, we tend to be reluctant to use checklists because we think somehow it might demean our skill level, or we might think that we don't need those checklists. I'm pretty confident that almost every pilot who is flying those planes could do that entire process without the checklist. But why would you do that? It just makes it easier, and it ensures that there will be no missed steps. And when we talk about data-driven decision-making, when we talk about implementing goals strategically, why would we not use a simple checklist? Because it doesn't cost us anything. It makes our job a little easier, and it ensures that we don't forget about some of these key parts. So just as kind of a spirit or attitude toward this idea, I think that makes you more able to be data-driven and to be more effective in measuring and implementing improvement. Think about the checklist from that perspective. It just makes life a little easier, so why not use it? All right, so back to we took a detour in our number 5 on data-driven decision-making to talk about SMART goals and kind of expand that concept quite a bit. So now we're going to move forward and talk about the remaining elements of the data-driven decision-making list. So consistently collecting data, right? Acquiring reliable data to inform key decisions. I think this one's kind of been a part of a lot of what we've been talking about. Data consistency sometimes is part of that looking for a good enough goal. So if you said to me, I've got a data source that gives me data once a quarter, that's a really good data source, and for this particular goal. And then you said to me, I've got another data source, it's not quite as good, and it gives me data once a week. Which one do you think I'd encourage you to look for? The really great one that gives it to you once a quarter, or the decent one that gives it to you once a week? Feel free to chat on a response if you have one. I'll tell you which one I would prefer. I would go for the good enough once a week. Yes, someone agrees. Thanks for that. If it's good enough, doesn't have to be great, it's accurate enough, and it's once a week, and that's a great frequency for driving my change efforts, for informing my team, for getting together at the staff meeting and saying, guess what? It's up, it's down. So we have a sensitivity if we're measuring it once a week, and a way of staying tuned in and sort of driving that urgency that's far superior to that once a quarter. Once a quarter is not going to drive our team process. This also speaks to that issue of rapid cycle change, and I'll get to that a little bit later when we talk about PDSA. If we're trying to do something quickly, we want data that we can measure with relative frequency. So consistent data collection at a reasonable interval that's reliable, that allows us to use as our compass. This is a good example of that compass idea, right? We have to be able to look down after we travel a little bit down the path, look at that compass and recalibrate our motions. And we don't want to imagine what it would be like if you set sail on your boat and just sort of set the compass and then went to sleep for 8 hours and then woke up to check. We might have some big problems, right? We have to be monitoring regularly because there's a lot of wind and waves and things happening that are going to impact how that boat moves forward, right? So that's something we're thinking about when we think about that consistent data collection. Consistent data collection means consistent data analysis, right? I should maybe call it that. We should call it that instead of collection, because it doesn't do any good if you just collect it. I've had those experiences where you're collecting data and then not using it because you're kind of backed up and too busy. Probably some of you have had that experience as well. So collecting it with consistency and using it to drive the process forward. So limiting your data collection, collecting only what you need, and avoid burdening the team. We talked about this as well already as we've been thinking our way through this process. So making sure that you're limiting your data collection. I'm familiar with this particular, the party shall remain nameless, but I know this very large system that is responsible for helping to promote planning among members of this system. And this very large system frequently will ask the members, would you like access to this data? Because they have a large website, it's a portal that allows access to a wide array of different data systems and structures. And so they will ask the constituents, the participants, would you like access to this data? And every time I see that question, I get a little frustrated because I think that's the wrong question. Because I can't imagine if I asked any of you, would you like access to the data, to particular data, that any of you would say no. It would sort of be a shameful response. Would you like information that's accurate and clear? No, thank you. I don't want that. But I would love it if someone did say, you know what? I have, that's not the highest priority data for me, and I don't want to distract myself from the data that is critical for me. It's good to know that it's available, but I really don't want you to push it to me because I think it's a distraction for me and my team right now because it's not a high priority data item. Nice to know it's available, thank you, but no, don't push that to me because we want to keep our eye on our compass heading here, and I don't want another compass that's measuring or another tool that's measuring another variable to distract us. So I think maybe the better question is, how could this be useful to you? Or would this be useful to you and how? Not do you want it or not? Because we want to ask people to analyze their data and to think about it from that perspective. So limiting the collection is not about putting your head in the sand. It's exactly the opposite. Because if you just get flooded by all sort of data sources, and many of you are kind of flooded by multiple data sources right now because the good news is you've gained access to a lot of data resources. The bad news is that some of you are drowning in it. Some of you have too much data. So let me just check our chat box. What about when you're being required by funding certified bodies for much data collection that is burdening, preventing the ability to limit? So yes, so when you have a mandate, which is you are required to submit these data elements, and if you say to that party, a funder, a certifying body, an oversight entity, I'm sorry, I don't think that your data request is going to help us to get better, and I don't think that it's very useful data anyway, and it doesn't reflect our quality, so I don't want to give it to you. I'm sure that's not going to go over well, right? You can't do that. So we have to be realistic in terms of those challenges. However, I do encourage through trade associations and other venues and just good advocacy and dialogue to work with those oversight entities, those funders, to say, you know what, data is critical, and we want to be data driven, and to not, rather than say you're burdening us with data requirements. That's never a particularly compelling argument. The better argument is to say, we have a proposal for an alternative orientation to some of the data-driven approach with you. Now, I know that might sound like a terribly naive orientation because a lot of our systems have been built, and year in and year out, they collect the same data, and they might not be that responsive to that sort of a perspective. But I choose optimism and hopefulness as a strategy. So I think it's reasonable to have an advocacy that says, you know, we'd like to propose a new orientation to data collection. We're not so sure that particular data set is all that useful to enhancing quality, and we'd like to advocate for a change. Not for not reporting data. We don't want to advocate for an end to data, but we'd like to advocate for an adjustment to how and what we report. Feel free to respond to me. Any thoughts you might have about that way of thinking. But I do appreciate the realities of some of your data collection, which is not by choice, but is by mandate. So if you can maintain a dialogue with those parties, and I'm hopeful that those systems can evolve across time toward more effective data. So as I'm talking to you, I'm also talking to the broader system and saying, let's not burden our provider system. If you're mandating it as a payer or a regulatory entity, oversight entity, let's not burden that system or hinder its capacity by asking for data elements that really don't have any utility in terms of measuring quality or improving quality. So that's my little optimistic speech on that, but I totally recognize the painful reality about that. So I'm glad that was offered as an item. So thank you for that. So yeah, let me know if you have any other thoughts on that. So number 6 on our data-driven decision-making list, reporting and charting progress. So I have this simple little graph that I've been showing here of a chart that I keep using as an example. And you'll note that I've said here, avoid data tables. Now there are certain reasons for data tables, you know, big spreadsheets with a lot of data elements, specific elements. You know, if you're doing research or doing some sort of detailed analysis of a particular activity, then that granular data is really important. Very rarely is that kind of granular data useful in driving data-driven decision-making with a team, with your staff team, with your administrative team, with your board of directors. What is far more helpful is a graphic representation, a simple line graph like the one you see here, or bar graphs or whatever kind of graphs are appropriate to the elements that are being measured. But generally in quality improvement work, the line graphs are probably the bread and butter that's most useful in terms of being able to monitor and so to see the relative change across time of a particular variable that we're measuring, and to be able to see a trend line, and are we moving up, are we moving down? We'll talk about this in relation to PDSA with a little more detail in a few minutes. So my strong encouragement as you're thinking about how you represent your data is to think about representing it in terms of that bar chart. Consider when you've been in your community and you've seen a fundraising chart on the side of a building or as a sign in front of the town library. It seems like they're less popular lately because everything is more digitally represented, but you might see it when you go to a website, when there's a certain percentage or a progress toward a certain goal. I have never lacked for some enthusiasm in myself when I have seen a marker that shows an increase in the movement toward the goal, and it always inspires me, tends to motivate me, tends to encourage me to want to promote whatever it is that they're doing if it's something that I think is valuable for the community. Those visual representations create emotional impact. Data tables do not. Except for the very few people who are who are doing that granular analysis who get excited about the data elements. For the vast majority, there's an emotional impact when you create a visual, a picture of what's happening, of the progress that's being made or not being made. That's why in media, when there's an effort to try to address an issue, they will often use different kinds of graphic representations because the numbers don't give you an impact. They numb you. Numbers numb, as a quote from someone I used to work with years ago. Whereas a pictorial description of what's happening does create impact. So when you're working with your team to be able to show this to them, I strongly encourage it to make a table and share it with them. And it's not a complex thing. All of you, know how to put a few numbers on an Excel spreadsheet, and if you don't, you can learn it in about 10 minutes, and then you can automatically create a table as long as you put some labels on those items, and it's very easy and accessible, and you can share that with your group without too much challenge. So if you haven't done it before, I encourage you to work with your team and to use a visual, because this is a nice way to gather the team together to focus on that information. And as we talk about PDSA, you'll see some of the value in that as we do that. I want to make a little plug here for our data dashboards. One of the questions that I get is people say, well, if I'm collecting data on each thing that I'm doing, does that mean I've got like one of these tables or one of these charts that I'm creating for each of my projects? So if you think about it like a dashboard, I mean, we don't want everything on the dashboard of our car, right? I don't care about a lot of the things that are going on in my car as long as it's working properly, but I do want to know how fast I'm going and how much gas I have, and I want to know if my doors are ajar, so all that stuff's good. There's other stuff that's not so critical. And so thinking about building a dashboard for yourselves, if you have a number of things that you're measuring and you have a nice data chart that you're developing and you maintain for each of those projects, to be able to put those together into a dashboard to say, at any given point, we've got 4 or 5 projects that we're doing, and we're keeping track of these 4 or 5 things, and we're bringing that to the team to look at it together. Let me ask a question. If any of you if you do something like this, or if you think that it would be realistic to do it. Some of you might say yes, some of you might say it seems like it would be challenging. I'd be curious about any feedback you might have. If you had a spreadsheet with a tab for each thing, with a table on it, with a graph that shows how it's going, and that each time you get together as a meeting, you take a look at that so that you are, in fact, with each of your meetings, doing data-driven decision-making. So that's a question to you. What does that sound like as a way to inform and structure your team meetings? So if you have any thoughts on that, just go ahead and pop them in there. Something that would be very helpful, a checklist spreadsheet, so someone would love it. Barry would be increasing the knowledge for how to do that. Okay, so a little bit of instruction and education. So then thinking about how you help your team members who might be asked to do that, to present that, to acquire the skills. Because our industry in general, behavioral health industry, it has a lower level of technical savvy around how to do some of this work than a lot of other industries. And so sometimes we have folks who might not have that skills. But as I said, these are quite attainable. We're not talking about high level analysis of data here that would be really challenging. We're, again, talking about keeping it simple. So I'm glad that point was made to sort of be mindful of that barrier, because we want this to be manageable, right? So the manageability factor is going to be really important for you. So keeping it simple, keeping it realistic is key. And smaller organizations have a harder time than larger, because larger organizations tend to have more administrative infrastructure. So they have management teams, and they have accountants who, and folks who do billing, and folks who are more comfortable and who spend their time in spreadsheets. The joke I like to tell is, you've got the person for this task if they write their letters in Excel, because I do know some people who are so focused in Excel that they actually write letters in it, which I think is kind of funny. Not something that I would do myself, but that just shows that that's where they do all their stuff, and it's perfectly functional as a place to write a letter. So those are the people who you want to help you if you have anybody on board. With some of our smaller organizations, you tend to not have that infrastructure of staff with that skill set. And so it might be a bit of a learning curve. So you might need to take a little time. And that could be a training. When we're thinking about staff training, how do we help folks to be able to do good data work? They might need some training on being effective there. All right, number 7, adding a secondary qualitative measure. So we've been talking about quantitative measures, more objective numbers, data-based measures, right? Data-driven decision making. That does not mean that we should just be dismissive of more subjective qualitative measures. In fact, they are often an excellent and important secondary source of information. So we can collect data about how people are doing in terms of that show rate example we were talking about earlier. We're implementing some change to try to get more people to show up for the initial appointments. And we can track our data and see how it's going as we implement whatever that change is. And we might also want to add in a secondary measure to that decision-making process, which is to say, what's that like for people? Because if we are doing something that is working, but that people find to be super difficult, or that people find to be annoying or agitating, on the short term, it might be beneficial, but in the long term, it might be burning out our staff or aggravating our clients. And so in the long term, it won't continue to be effective. You can probably harass people to get them in the door, but then they might not come back after a while because they don't want to be harassed by you. So you have to find a way to try to encourage that show rate that is acceptable to your customers. So knowing your customers here is critical, and knowing your staff is critical. And you probably only get that through some qualitative measurement, right? Maybe that's an interview, focus group, survey, some vehicle for having a conversation with those people to ask them, how's this going for you? What do you think about this? What are the challenges for this? Et cetera, right? So that's something that you want to keep an eye on. I did just get another question about the slides being available. Yes, we will have the slides available for you, so no problem with that. I think Karina will make mention of that at the bottom of the presentation when we wrap up just before noon. So thinking about adding those additional measures is a good idea. We want to be data-driven as our primary orientation, and that's going to be informed by some understanding of the human factors and the human experience related to whatever it is we're trying to do. We have to know how it feels for people. So important to keep that in the mix. The problem that we often have is that people tend to just focus on how it feels for people. They want to shift that prioritization toward the data first, then also considering those experiential elements, those more subjective elements. So number 8, asking questions. Asking questions about the results. We want to study those results. We want to consider what other variables might be at play. What was how did we do with our data collection procedure? It's always important with data-driven decision making to ask the question, was our data, were we faithful to our strategy? Did we collect properly? Is our data accurate? Always asking, because there are so many ways that it can get messed up. We've all had those experiences where we thought we understood the data, and then you realize, oh my gosh, it's not what we thought it was. Or, oh my gosh, we didn't collect it properly. Or, oh my gosh, we left out several weeks because so-and-so was on vacation and we forgot to collect it. So we really don't know what's going on. So always looking and asking questions about the results. Always look at them with a slightly suspicious, skeptical eye in terms of accuracy. I don't mean cynically, but always a little bit of a concern to say, is this what we think it is? Did we do this the way we said we were going to do this? And does it reflect what we were trying to measure accurately? Always important to ask that. Because if you just accept it at face value without being critical in your analysis, then you might be, it's sort of like asking, is my compass still working, right? So calibrating your compass. I don't know if any of you put a compass on your phone. On your phone, you can sort of have a digital compass, but you have to recalibrate them, by moving them in certain ways. I don't know if any of you have one of those. I just have one on for fun mostly. But if you just use it without having used it in a while, it's totally inaccurate, right? It needs to be recalibrated by moving it in certain ways. So you have to ask that question, is it accurate? because I can't take action on this until I ask that question. So asking questions is always important with everything, right? Always asking questions, and no different with data-driven decision making. All right. So those are our 8 areas that we've been working our way through. I want to stop and pause and see if we have any quick questions about those. If you can take a minute to chat. I'll just kind of walk through them again if there's any chat box responses or any questions or comments related to these 8 areas. We want to have clearly defined measures. We want to collect baseline always to know where we're going. We have to know where we've been. We want to define a clear aim, concrete and focused. We want to be consistent in our data collection. More frequent is better than less frequent so that we can use it to monitor. We want to limit our data collection to stuff that's realistic. We want to report, create good charts that have an emotional impact on folks. We consider a secondary qualitative measure that allows us to understand the human experience, and keep asking good questions. So if anybody has any comments or questions about any of those, feel free to pop those into our chat box. And as I did say before, we'll certainly give you these slides. Again, these I think are nice checklists to think about how you're doing as it relates to being data-driven. When someone asks you, well, are you data-driven in your decision making? And you say, yeah, sure we are. And they say, well, how do you know you're data-driven? Well, look at this list of 8 things. If you're doing them, then you can honestly say yes and truthfully say yes. If you're not doing them, then you might be giving a little bit of lip service to the idea. Most of us no one would be inclined to say, no, I don't use data, I don't like data, and I don't use it to drive my decision making. Not too many of us these days would say that. I think we all recognize that data is important. But are we actually living it by doing these things? So that's something you all can be thinking about. All right. So now we're going to pivot a little bit, and we're going to talk about a vehicle for implementing with data-driven decision making. So a lot of you might be saying, okay, great. So data-driven decision making, yeah, that's great. So what's a tool? What's a strategy for actually using that? How do we actually implement using that kind of an approach, right? So we're going to talk about PDSA, Plan, Do, Study, Act, which you indicated at the top of our conversation. Very few of you had any familiarity with. We did have one question though before I do that, which was keeping up with the technology, and I think technology relates to that data collection challenge in terms of getting good data from folks. If you have someone in your system who has a good awareness and knowledge of using technology to gather data, using simple strategies. Although I always like to say, when it comes to quality improvement work or evidence-based practice implementation, I like to think about simple data. One guy I've done some work with who I really respect had this history of going to trainings and giving everybody in the room some graph paper and a pencil and saying, this is all you really need. Now, he might have been exaggerating it a little bit, but it was a very strong and powerful argument, which is that you do not need high levels of technology to count stuff and to then graph what you count across time. And that's really what I'm trying to focus you on. Count stuff and then graph it across time. How many times did X happen today? How many times did X happen yesterday? Did it go up or did it go down? And that's at the core of good quality improvement work. The trick is not in the complexity of the technology. The trick is in the consistency of monitoring and managing that process that allows you to do that. And holding onto that clipboard and actually checking the boxes and making sure that your staff member does that. It is not a high-tech process. Obviously, we want to be able to use our technologies as best we can to make these things efficient, but at its root, it's a consistent and simple practice. Okay? But it's like a lot of things that are simple and consistent, like taking our blood pressure medication or exercising or eating right or whatever you want to pick as a behavior. Simple things. The trick is in the consistency of the behavior, and that's what I would encourage you to focus on. Okay. All right. So let's think a little bit about PDSA here. And so this is the vehicle. The PDSA, as you see, is the vehicle for carrying the evidence-based practice or the data-driven decision making. So what is PDSA? So here's a simple graphic of PDSA. This work comes out of post-World War II industrialization. In Japan, the economy was rebuilt after World War II, mostly through the support of a lot of consultants, many of whom were key folks from America, industrial consultants who helped them to rebuild an economy, which has become, of course, incredibly famous and historic in terms of its power as it was rebuilt, in large part based on these process improvement models and rapid cycle change models. Some of you may have heard of PDSA, a few of you had, Six Sigma, some other models of process improvement work, which is all about engineering, re-engineering the process to create efficiencies. Think about an assembly line. Think about a traditional assembly line where the assembly line workers would just keep cranking out things that were broken and didn't work because they weren't empowered to think about doing it better. And then think about a more contemporary assembly line, like in some of those powerhouse Japanese companies like Toyota, where if a worker sees a flaw in that assembly line, his or her job is to pull the cord that stops the line to fix the problem with the process so that the product can be ensured as high quality, and that worker gets rewarded for having done that. Back in the day in the American car industry, when we were struggling with quality of cars, say 70s, in America, 70s, 80s, if a worker had stopped the assembly line, he or she probably would have been fired because the agenda was cranking out units even though they were flawed. And that was a very wrong-headed mindset, and we recognize that now. Now, American industry, which was the root of a lot of this stuff, companies like General Electric, Motorola, were the root places where these models were developed. Then were used in Japan. Now that's come back to America and has really helped a lot of American industries. So then this stuff became popular in healthcare and is now becoming more popular in behavioral healthcare. I've done a lot of work with NIATX, that's NIATX, which is rooted in this work, as well as places like Institute for Healthcare Improvement and some other quality organizations that focus on this model. The idea is you plan a project. If you look at this like a clock, starting in the top right quadrant, then you do the project, then you study the results, and you take action. And you do this rapidly. When we were talking about quickly implementing change, this is a model. And if you Google this model, you will see a whole bunch of stuff talking to you about how to do change implementation. So it's all about improving a process and specifically focusing on a particular element. So first we plan. We think about what our goal is. We look at what we want to test. Think about like a basic scientific method. As we were talking earlier, we want to do an experiment and try and see if this will make an improvement. We have a problem with our show rates. What happens if we call people the day before their appointment? Does it increase the show rate or does it not increase the show rate? We'll introduce one simple test to see what will happen. That's our plan. We're going to go ahead and try that and see if it improves the show rate. Then we actually do the thing, right? And we watch as we're doing it. We see if there's challenges or problems as we're implementing this change project. We see what our preliminary data is telling us as we do it. See if there's any problems in doing it, if it's manageable for us. Then we study our results. As we're studying our results, we're going to see, well, did it work? Did more people show up as a result of us calling them the day before the appointment? Again, we'd better make sure we had a good baseline in place in order to check on that. And what did we learn from the results of this test that we've done? And then we wanted to take action. So plan, do, study, act. And we have 3 potential actions that we can take. Those are the items that are bolded. We can adopt this. Let's say we did this quick change project and it worked wonderfully. We had a huge 30% increase in show rate when we call people the day before. This should become our new policy and procedure. We're going to do this going forward. It's no longer an experiment. It's now the way we do business. We're adopting this. It's wonderful. We might adapt it. We might tweak it a little bit because we might need to adjust it. You know what? We're thinking that we only got halfway to our goal. We really wanted to increase our show rate from 50% to 80%. We only got from 50 to 65. So we're thinking that we should call them twice. Instead of just the day before, we're going to call them 2 days before and the day before and see if that works better. So that would be another cycle of our change where we would start the plan, do, study, act all over again. And in that case, we're going to measure it again and see if that works, because we're only changing one thing at a time. Remember, high school scientific method, you can't change two things at a time because then you don't know what had the impact, right? We want to know what the impact is. The third option is we abandon it because it just doesn't work. Let's say we called everybody the day before the appointment. The show rate didn't change, or maybe even got worse. So, and there's times when that would happen, right? In some circumstances, let's say our clientele, they don't have stable phone numbers, or they don't tend to respond to numbers when it's people other than a select few folks, or they don't tend to, they didn't tend to pick up their phones, or whatever reasons. There are several reasons where with some populations, these reminder calls just don't work very well. Those are some of them. And so we say we're abandoning it. You know what? This doesn't help with our clientele. We thought it might help, but it doesn't seem to help. So we're just not going to do that anymore. So would we call that a failure? No, we would not call it a failure because now we have really good information about something that doesn't work. So we're not going to do that anymore. So I'm going to check a comment I have about reminders. Far less responsible. Most professions now rely on their constant follow-up calendar warnings and reminders. Yes. So being mindful about what happens when we do a lot of reminder systems. Does it sort of take responsibility away from people? So I think that comment should be used. Thinking about my example, being mindful of the context. You can overdo reminders, just like if you overdo reminders on your phone, so that your phone buzzes every 10 minutes. After a while, you're just going to stop listening to it. So you have to be mindful and thoughtful about how you use these systems in order for them to be helpful, either with staff or with clients. So it's a good point that's being raised. So thanks for that. So thinking about this PDSA and thinking about how you will think about the adopt, adapt, or abandon at the end. So here's a broader picture of what I was just walking you through. So this is kind of the larger process. 10-step model that I think is a useful way to think about this. If we think about our goals, remember we were talking about goals at the beginning of our conversation. There are some tools that you can use to figure out what that goal should be, coming up with that goal, improve A from B to C by date D, right? Then we have to come up with step 2, choosing a change. What will we do to improve? In this case, we decided our thing was going to be reminder calls to get people to show up. And then how do we plan to measure that progress, right? So we figured out what we're going to change. So now we got to measure this. We have to keep track of whether or not we're doing these calls. We have to keep track of whether or not people come in. Probably want to now create a nice table graphic, as we talked about earlier, for how to show the progress and show that to our team as we're thinking about this together. And then we put it into motion. We planned it all out. Now we've planned this project. Now we're going to do this PDSA. That's that meat in the middle of it, 4, 5, 6, and 7. And you'll see that little off to the right, the data circles with multi-cycles. Now when I said we're going to call them once, and that kind of didn't work as much as we thought it would, now we're going to call them twice. That's called a second cycle, because we're going to loop back around and say, okay, back to the drawing board. Let's plan it and adjust it and run it again and see if we get a better result with the second cycle. People who get effective with using this model will have multiple cycles of change that they will do on the same aim, and they'll keep slowly working their way toward the goal. It's kind of like that game that you play in the swimming pool, you know, Marco Polo, right? That game. So this idea is you get some data and you make an adjustment and move toward your target, and then you get more data and find out if you need to make another adjustment and move toward your target. And each time you do another cycle, it's like that Marco Polo, back and forth is like another cycle, which gets you closer to your goal each time you do another cycle of a change project. So that's sort of a silly example I like to use to think about what it looks like as you're trying to move your way toward that primary goal of, in this case, our example, getting more people to show up for services. So after we've done this PDSA, and at the end we do that abandon, adapt, or adopt, right? That's our action in step 7. And I want to underscore that it is not a failure if you don't achieve what you had intended to achieve. You can do another cycle, or you can abandon the change project and do something different. I've worked through the years with a lot of organizations who were very convinced that the stuff that they were doing was highly effective. And oftentimes it's not. There might be 4 things that you might be doing, sticking with our example, to get people to show up, right? Maybe only one of them actually gets people to show up, and the other 3 are dead weights that you're carrying around, and you're wasting your staff time and resources on those 3 things. You think that that 4-part approach is what's getting it done because you never tested it. If we tested it, we find out that only one of them actually has impact, and the other 3 are kind of nothing. And boy, are you wasting a lot of resources on those other 3 things. And that's time and money and energy that could be spent doing other important things to promote your mission, to support the people you serve. So it's really critical to think about this from that perspective. We need to test things to understand, and we have assumptions about what works and what doesn't work when we haven't tested things. And you might be shocked to learn that some of your core assumptions are inaccurate. I know I've been shocked multiple times because I've been highly convinced that something that I was doing or a team I was working with was effective, but then when we kind of broke it apart, we realized that it really wasn't. And that's not failure. That's an important learning to be able to make sure that we use our resources efficiently, because we all know that we don't have enough resources to do the important hard work that we're doing. So I want to really underscore that piece. So then we get down to the post-change steps at the bottom with 9 and 10, where we talk about sustainment and spreading the change. So I always encourage with this model that you do a pilot project, a small pilot project. You know, if you've got 12 counselors and you're thinking about having everybody implement a change with their caseloads, let's just try it with 2 or 3 people instead of with all 12. Well, let's see how it goes with that small pilot. And then if it works well, we're going to sustain that, and then we're going to spread it to the rest of them, right? We don't necessarily want to start with everybody. We want to do small and simple so we can manage it. Then we spread out to that broader group, okay? So sustaining the change, as we said before, using those data-driven decision-making tools, you can then work on sustaining, using those that checklist to sustain what has worked for you. And then we spread it across the system, and you can also spread it across your bigger community, other providers. A lot of learning collaboratives where you work with other providers to kind of compare ideas and share experiences can be really helpful here. So a question comes up, can you have 2 or 3 tests one thing and maybe a different 2 or 3 tests something else? Absolutely, that's a great strategy. That's a little more complicated because now you're spinning 2 things at the same time. So you have to ask yourself, do you have the bandwidth and the experience and the resources to do 2 things at once? I always encourage organizations to do 1 change project in 1 service, 1 pilot test to get started, and then do another one. And then over time, if you get acclimated and skilled in using this kind of a model, you can do multiple at once. Have to make sure that they're separate from each other, right? Again, back to high school scientific method. Don't be mixing up stuff in the same flask, in the same test tube, right? We want to have separate experiments here. Make sure that they're not interacting with each other to make sure they don't kind of contaminate each other in terms of their influence. But if you can do that, then that's great if you have the resources. And that's usually a more sophisticated system that's gotten to a spot where you have the capacity to do that. So this is the model that has been used by many, and it's pretty tried and true. As I said, it's very effectively used by, at this point, thousands of providers in healthcare and across behavioral health systems. Plenty of providers in Florida who've been using these models as a result of their work with a number of different organizations. So if we think about this, again, from this perspective, a bigger picture on our graphic here, we come up with that stretch goal at the top, which is trying to get to that level of a show rate, right, which is our stretch goal. We see our trend in our data across time, and we see that it's generally moving upward. This is this multi-cycle change idea where we do PDSA after PDSA. Here on our picture, we've got a baseline followed by 2 change cycles and then a sustained period, because we did pretty well with moving our data up toward our goal. And now we're able to work on sustaining that effort across time. That's where we put that on that data dashboard that we talked about earlier. And that's where we saw the capacity to kind of look at multiple change projects across time and to keep track of those and to make them now our standard practice because they were effective and they worked well for us. So I want to now ask if there's any questions, because we're getting down to our last few minutes. We're only got 3 or 4 or 5 minutes before we're going to wrap up and hand things back to Karina for final business that we have to attend to. Thinking about how you can use PDSA, data-driven decision-making, SMART goals to implement your evidence-based practices or other changes. Thoughts, comments, questions as we wind down and as you think about the material that we've been looking at today. Obviously, you'll have the slides that'll be shared with you, and so go ahead and ask any questions if you have them. I'll also have my email address available to you as well, so that you can. And there's my phone number and email address. If you had any conversations that you'd want to have with me, feel free to do that. But any questions right now as you're thinking about how you might implement these elements that we've been discussing today?
So if you have,
go ahead, Karina.
Have any questions you want to share, go ahead and post those now, please. Thank you.
And a good question, good comment in terms of writing grants. This is a really useful tool set for writing grants. And if you let payers know that you're using these models, it's an indication that you have a level of sophistication and awareness. If you can prove that you're using these models to implement effectively, it will definitely help you in acquiring funding. So I would recommend you practice it and then let them know you're using it. Any other thoughts, questions, any other challenges? I always like the yeah, but challenge questions. Those are always really helpful to refining our thinking a little bit. Is anyone thinking, yeah, but X, Y, and Z? So if anybody has any of those, I always like to have those because they are useful to us clarifying any concerns. Time is a barrier, absolutely. That's why we want to be efficient. I see a good comment around time. Want to be efficient, be humble in terms of our sense of what we can accomplish, be realistic, and try to keep things simple and clear. Because, yeah, you're fighting against time, and it's easy to get this stuff spinning into too much complexity. So keeping it simple is critical. Okay, yeah. Appreciate the thanks from folks who said that this was a helpful learning opportunity. So I thank you for that. Any other final questions before we move toward winding down today? I've appreciated the comments. The comments have come in on a regular basis, which is helpful and has helped me. It's a little more challenging when we don't have a way of conversing with audio, and the only way we get a sense of how you're doing is by having you share stuff. Thank you all for doing that. It's really been a good way for me to sort of stay dialed in.
Matt, we also want to thank you for presenting today. You shared a great presentation and we had a lot of interaction, and we do appreciate you addressing all the questions during the presentation. It seems like you did a really good job of staying caught up. I don't see any further questions out there, just a lot of great comments. So we again want to thank you, and if you guys want to stay on for a few minutes so I can go over the CEU process, that would be great. Thank you, Matt.
Oh, you're welcome, Karina. Pleasure doing it. I wish you all well. Thanks very much. Good to be with you all today.
Okay, guys, so everyone, I went ahead and just posted his information here in case you need to email him with any further questions or comments. But basically, we're going to go ahead and move on to our evaluation. Once we close out the webinar, your browser will take you to an evaluation on our website. If you want to receive CE credits or a statement of credit for this event, it's very important that you complete the evaluation. One thing I wanted to mention to you is that you do need to have a profile created in our site to complete the evaluation. Just registering for the event does not complete your profile. So if you're not able to get into your evaluation, it's probably because you have not created a profile yet. So please create your profile, and then you'll need to sign in. If you haven't created one, you can click on haven't registered yet to create one. Once you register, you can register as a visitor. Your evaluation should open up and you can complete the evaluation. For CEs to be reported to CE broker for Florida licensed healthcare practitioners, you must also provide an accurate Florida Department of Health license and prefix number the first time that you register. Just a quick reminder, the evaluation closes on midnight, Monday, August the 3rd. Once you do complete the evaluation, you will receive a thank you for submitting your eval confirmation that you did submit it. And then once again, this process can take up to 30 days. If you do want your information reported to CE broker, we do need your license and entered into the profile. And then as far as our presentation and the recording, we typically have it up within 30 days. We do try to post that sooner if we can, but it's usually up within 30 days. And also your credits will be posted it may take up to 30 days. And we start that after the evaluation closes on August the 3rd. So kind of be patient and don't expect CEs or the accredited statement to post right away after you complete the evaluation. Once you complete the evaluation, again, it takes up to 30 days. Your credits will show up in your profile under professional development. We do not email the statements of credit. We have to confirm and verify that your attendance that you attended both visually and audibly, and also you completed the evaluation. And we also want to thank you for participating in today's webinar. We'd also like to recognize and thank especially the Florida Department of Children and Families Office of Substance Abuse and Mental Health for funding today's education. Please have a great rest of your day and hold for our evaluation. Thank you.